Why can't you get that energy and lose that weight? Hey everyone, it's Dr. Eric, the fitness physician. I'm all about natural health and getting back to our prime health and fighting back against the traditional sick care model and social media gurus that and quick meal clinics that are out there trying to beat us down and just churn us in and out and just give us pills and run us through the mill to make a quick buck without actually treating the root cause, underlying nature of our illness and our problems. And my goal is to keep you and all of us healthy, strong, and prime and getting to the basics, getting back to our primal nature of getting outside, getting away from electronics, from artificial crap, and getting back to health. That's what it's all about. So that's my program is all about that hormonal fitness, muscle medicine, and getting back to nature. That way we can live a life of strength, power, and be able to give back to those around us. So that's my goal for everyone. And I'm always extolling this on my videos. I'm very passionate about this because obviously there's a lot of uh, let's just say the powers that be, as I say, big pharma, big government, et cetera, that are, again, just trying to weaken us, make us dumb, watch social media, sit in front of computers, take foods and stuff with loaded with chemicals and BPA and xenoestrogens and et cetera, and demasculating us, the men, and making us weak and dumb and sad. And that's not the way to go. I want us to be strong and vibrant men and women, to be strong, powerful, and thoughtful. So that's what I encourage. That's what I hope for all of you and for all my clients. And I try to do that in the most natural way possible. And the topic, as I've been talking a few social posts earlier about health and especially about thyroid health, because this is a big topic, right? And a lot of people just can't get through the day. They can't shift it into gear. They're always tired. They're a little bit of a brain fog, can't lose the weight, and getting some soreness, maybe some puffiness, some constipation. Their hair is thinning, skin's kind of dry, and they're just wondering why. And a lot of people think that it could be the thyroid, but they're not sure how to approach it, or they know it's the thyroid and they're not getting the right care, or their symptoms are kind of getting glossed over, or they're getting put on a synthetic live with thyroid medication, and it's not helping. So the importance of thyroid is massive, and I could talk for hours about this, but I'm going to keep it short today. But basically, thyroid health is pivotal, it's crucial, because the thyroid metabolism, the thyroid hormones pretty much affect every aspect of your body. They're not just involved in metabolism. And no, it's not like a Red Bull. It's not like it's semaglutide. We're going to drop weight and just get lean and jacked by taking thyroid hormone. That's not the goal. The goal is to utilize thyroid hormone when it's necessary and at the right time, at the right dose, because you have to be very careful. It is a very powerful medication. So you do have to be very careful with this, as with everything, right? So basically, with thyroid hormone, as I mentioned, it basically acts everywhere in the body. It's one of the master regulator hormones. And one of the things that people forget about is it acts very powerful for emotional health, cognitive health, and brain health. A lot of people with brain fog and fatigue and tiredness, and then just memory problems, emotional problems, depression, anxiety. This is massively helpful. Back for decades, this was the treatment for depression and treatment-resistant depression. And psychologists are actually have kind of rediscovered this. And there's still a lot of them who are very savvy and use this today because they realize this. And it was very successful. And again, more natural. We don't have a Prozac deficiency in our brain. It didn't exist, right? But we can't have a thyroid deficiency. And it's very successful for treating depression. And a lot of people like I said, this was done for many decades successfully. It was also used to prevent heart disease. Though, if you read the works of Dr. Broda Barnes, who treated thousands of patients, did tons of studies, not only here, but in Austria, and other countries too, where basically, he wrote a couple of books about this, how the proper thyroid optimization could actually prevent heart disease, because they found out that the thyroid hormone has effects in the heart and the vasculature, in the blood vessels, and in other tissues too. And then he wrote about many other problems, migraines, fibromyalgia, PCOS, insulin resistance, vascular disease, atherosclerosis, diabetes, and so many other issues that were successfully treated with thyroid, because again of the far-reaching effects of thyroid hormone. They found out that basically when there's not enough thyroid hormone, you get an accumulation of you get some what's called mucopolysaccharides accumulating in the tissues, which can lead to thickening of tissues, arteries, lead to swelling in the tissues, puffiness in the skin, and it gets in the nerves and the blood vessels, and that's what causes all these weird, strange symptoms. So again, too much to get into here, but the results and the effects are far-reaching and extensive. Definitely has a role, of course, in metabolism. It can affect appetite and, of course, weight. So if you're having some issues with stubborn weight gain, this may be a missing piece. But It's not always, and it can be a small part of it, but it can be a very important part of it. And again, I mentioned brain fog, cognitive health, mood like depression, anxiety, and more importantly, again, like I mentioned earlier, for vascular health and heart health, which is the number one killer of men and women, as I talk about on my videos frequently. So really digging into that, if you're optimizing heart function, people have found that a lot of these studies do show that with optimal thyroid function, you can live longer and prevent heart disease and some of these other diseases like metabolic syndrome and diabetes and much, much more. Um, and thyroid, of course, plays a role, as I talk about with all the hormones. They're all connected. And the thyroid hormone affects all the hormones. Can definitely have a powerful impact on growth hormone, testosterone, estrogen, progesterone, DHEA, and your adrenal hormones. If that's off, if the thyroid hormone is off, it's going to affect all these, and vice versa. If extensive stress, adrenal stress, cortisol stress can affect your thyroid function in a very bad way. They're very interrelated, these two hormones. So a lot of people that have, quote unquote, adrenal hypofunction or adrenal fatigue, oftentimes it's related to thyroid and vice versa. Same thing, thyroid can definitely affect growth hormones. I work with a lot of patients with growth hormone using therapies with peptide therapies and et cetera. And this can be very much crucial to evaluate thyroid. And you have to be very careful because sometimes if you're doing this in a certain way, it can unmask certain deficiencies. If you're doing growth hormone therapy or peptide therapy, it can actually unmask a hidden thyroid disorder. Again, way too much to get into here, so stay tuned for future videos and I'll talk about this. But they affect one another, so have to be very careful. It's not just a question, I'm just going to give you thyroid hormone. I'm just going to give you this, like you see on social media gurus. It's very complex because all these connect and they all affect each other, all these different hormones. And then when you move one lever, it moves another. Then instead, you don't just give this or fix this. You have to do other things too. So again, it can be very complicated sometimes. So they're all interconnected. You have to be very careful with this. And when I mentioned earlier, someone posted on my social media about what do you mean by careful? I did on a video earlier because thyroid is very powerful, like all hormones, all peptides. You don't want to just be willy-nilly taking these things. You have to watch for symptoms. You have to look for contraindications. You have to look for things that could be affecting it. There's a million things that can affect thyroid hormone, other prescription medications, other supplements, other hormones, other genetic factors. That can affect this. So you may need less or more of a certain hormone, or you may not be able to do certain supplements. So you have to look at all these things, and it can take a little bit of time. But the biggest thing is to monitor, as with everything, is about how you feel, how your symptoms are. And if you're on a medication, you're on a hormone, you want to get this assessed by a qualified medical professional and go through your symptom list, go through your labs in detail to see what's going on. It might be a subtle sign there that you're missing. And if something is feeling off, you're not feeling good, or there's a laboratory valve that's off, it needs to be addressed. So please work with a qualified physician or practitioner who knows what they're doing, who's trained and certified in medical therapy, has medical licensing, not just the buff chick on social media or whoever who says they're a guru because they've been to a few conferences, interviewed a few docs like me. They don't have the training and they just don't know. They don't know all the nuances. And I'm not saying to bash them. I know there's a lot of people who have a big heart. They're doing a great job out there bringing awareness and getting people in. But most of the good ones are working with professionals and who know what they're doing, and they're getting it done. And again, it doesn't have to be me, but it can be one of my colleagues. But please just work with a medical professional, but who knows what they're doing. Now again, as I said at the beginning, the traditional medical model, they don't know a whole lot about hormones, so don't go to them either. And again, I'm not, again, trust me, I don't know everything. None of us knows everything. So we're all learning. Everybody's learning every single day. But the whole point is to have a team and work with someone in the medical world who knows what they're doing, because these are very powerful medications and you have to be cautious and you have to approach them gently. Just like you don't go in a gym and just talk to the bro over there in the corner, looks like he's jacked, to have him help you squat. He's going to mess you up if he doesn't know squat mechanics, right? So you have to be very careful and just do it the right way. That's all I'm saying. Just do it the right way, be cautious, and get help. We all get help. I get help. We all get help. So just do it the right way. And so if you're working with a hormone specialist, make sure they know all the nuances, they know what to look for, they know the labs to look for, because again, there's a lot of other things that can affect thyroid metabolism. So in general, of course, I do prefer natural bioidentical thyroid therapy as opposed to the synthetic drugs like Synthroid, although some people do fine with it. But you also have to look at other factors too. That some people can have mineral deficiencies, vitamin deficiencies that can play into this. So, things like selenium, iodine, magnesium, B vitamins, vitamin C. If you're deficient in some of these, the thyroid is just not going to be working optimally. So you have to address this. You have to look at toxicities. Perhaps they've had a mold exposure or metal toxicities. You have to look at their gut because, of course, the gut is crucial to everything. So someone's having some odd symptoms or they're on the treatment therapy and it's just not getting results. They may have a gut issue that needs to be addressed. They may be sleep deficient. Their cortisol may be out of whack. So you got to look at all these factors. So make sure that they're doing a full assessment of symptoms, doing a full assessment of laboratory workup, and doing any advanced tests as necessary, like micronutrient analysis, genetic testing, gut testing. And I do this a lot with all my clients to get a deep dive. Again, I'm all about treating you at the cellular level, peeling back the layers of the onion and treating from the root cause, right? We want to figure out what's going on and what we can do to address it. It's not just about giving a medicine, giving hormone, boom, that's easy. It's that easy. There's a lot more to it. Again, you have to address all these factors because if you have a micronutrient deficiency, you have a certain genetic SNP, you have a gut microbiome imbalance, then you need other things to be done. You can't just give thyroid or give testosterone. You have to address these things for them to work properly. Otherwise, again, you're going to have a disaster. And how do I know this? Because I've seen it. I've seen it myself, and I've seen a lot of people come to me from other practitioners and other clinics, and they're not doing this, and they get messed up. They're on these cookie cutter protocols, and something happens. And this is why you have to look at these subtle little factors sometimes that get missed. So there's a lot to it. And sorry to harp on that, but it's important because I care. I want you to feel good, and I don't want you to have harm. So thyroid is if you're having some vague symptoms, if you're having unexplained fatigue, brain fog, weight issues, joint issues, or any other concerning factors. You got some cholesterol levels that are off, and despite everything else. Well, look at your thyroid. You may need to get that evaluated. You want to get a full thyroid panel. Get a TSH, a free T4, a free T3. Sometimes we reverse T3, and then you want to look at all these other things like minerals, nutrient deficiencies. You can get a gut evaluation, micronutrient tests, and there's so much more. But those are just the basics, and that's on top of a regular nutrient panel. I have my own custom-made lab panel that kind of looks at all these things, and then I can do a deep dive with the micronutrients genetics as needed. So again, if you're having some vague symptoms, if you're feeling a little bit off, like I mentioned, any of these symptoms, especially people complain of thinning hair, dry skin, dry hair, constipation, gut issues, menstrual irregularities in women, some insulin resistance, if you think you may have PCOS, fatigue, weight gain, brain fog, any of these symptoms. Again, you want to look at your thyroid. Again, you have to look at other things too, but this is one missing piece. And I see this a lot where people come in and they have this and everything's quote unquote normal, but something's off. And again, if you have symptoms, I'm not too worried about where your blood work is because you may not have, it may not be getting into the cells. So it's about the cellular treatment. That's why I practice cellular medicine. So you may have a lot of thyroid hormone on your blood test floating around the bloodstream, but if it's not getting into the tissue, it's not working. And why is it not working? Well, it goes back to what I was telling earlier. All the other things we have to look at, micronutrients, toxicities, other hormones, other medications. So you can see how this can get a little bit complex. So again, if you have any of these issues, please get a full evaluation with a medical pro who knows what they're doing. Get the full laboratory evaluation and then start ticking off the boxes. And let's get you back to prime health. So please share this post, check out my social media. I'm everywhere, and I got videos up all over. I'm doing telemedicine all across the country, drericprimex.com. And if you let me know what you think, comment your thoughts about thyroid below, and everyone having a rocking day. Please remember to live to give, do something nice for someone, pass it forward, and we'll talk to you soon.